I'm Dr. Girish, physician, neurophysician, and neurosurgeon. This is the part 5 of the continuing medical education program organized by Padma Clinic and Nursing Home, Chennai, in coordination with the Lions Club of Madras Excellence, Lions Clubs International, District 32485. Today's topic is on the significance of doctor-patient communication. Effective doctor-patient communication is very important in building the therapeutic relationship. Effective patient communication is the heart and the art of medicine. Much patient dissatisfactions and complaints are due to the breakdown in doctor-patient communication. The ultimate goal of an effective doctor-patient communication is to improve the patient's health and medical care. Now, just let us see the points for the good communication and interacting with the patient. As the patient walks in, the patient develops an impression. The first impression is the most important. So as the patient walks in, the doctor should get up and wish the patient and the family member with a smiling face. Very important. That smile and the warmth as from the doctor, as the patient walks in, makes a wonderful difference for the patient. Introduce yourself. The doctor should introduce himself with a smiling face and address the patient by the name, because by the time the patient walks in, the doctor would have known the name of the patient. So address the patient by name. Somebody calls you by your name. If somebody calls me, yes, Dr. Girish, how are you? I feel so proud. The same aspect is with that of the patient. Next, offer the chair and request them to sit down. So make the patient feel at ease as they walk and sit down, because each one of them will be coming with a tremendous tension as a result of their medical problem, what they are facing. Second, request the patient to explain his or her problem. Let the patient tell their story. Don't interrupt. Show to the patient that you're very eager to listen. Make eye contact. Look into the eyes of the patient when the patient is talking, so that the patient will feel, yes, he's a doctor who's listening to me. Listen to understand rather than just to oppose. Take down the points. As the patient is narrating the events of his medical complaints, take down the points. The patient will feel, yes, this doctor is listening to me. Listen accurately to the patient. You can even rephrase what the patient said. Can I just ask you something? Did you say like this? This tells the patient, that you are listening to what the patient tells. Remove distractions. Don't busy yourself with other things. As the patient is narrating his story, don't tap or shuffle paper or use the mobile or watch TV instead, but please concentrate on the top of the patient. Empathize with the patient. You need not sympathize, but you must empathize. That means you're slipping into the shoes of the patient and trying to feel what the patient exactly feels. That's exactly what you're doing. You really know. No, you can even tell the patient, I understand how much you feel, and I feel sorry about it. And let's see what we can do. And let me see how much I can help you. The patient really understands, yes, here is a doctor who has understood me. Very important. So empathize with the patient. Put yourself in his or her place, and then only you can see from his or her point of view. Very important. As you're interacting with the patient, suppress all the desires to leave the hall. Don't head for the door immediately. It embarrasses and distracts the patients. It also diverts the attention, and you'll be asking the patient to repeat the history again and again, which in fact the patient can get irritated. Avoid arguments and criticism. The patient may become defensive, or he or she may calm up or get angry. Avoid leading questions and close-ended questions. Ask open-ended questions. Please describe about the pain. What are you having? Suppose she says that she's got a neck pain. Please describe about the neck pain. Let her describe about the neck pain in her own language. Listen to that. Now, it's very important. Studies have shown that the first 3 minutes of the interaction between the patient and the doctor is a time what the patient takes the time, in fact, to narrate the history or whatever the suffering what the patient is undergoing. What the patient tells will be the first 3 minutes. But it so happens that the patient is being interrupted in the first 1 minute itself, so that the doctor will start asking leading questions. That should not happen. Let the patient tell the story in their own language. Very, very important. And wait for the patient to finish telling the story. Ask one question at a time. Once after the patient has finished the narration, then you can put leading questions to the patient. After which you can examine the patient with the permission of the patient. Then, of course, after all that is over, summarize and provide your thoughts. Explain in detail the investigations to be done. Very important. Once a patient comes with the investigation result, that is the next visit, explain in detail about the diagnosis, the treatment, any alternatives, prognosis in the patient's own language. Very important. Extremely important that it should be in the patient's own language. And if a situation is such, you're not able to talk in the patient's own language, have an interpreter with you. Avoid using medical jargon or abbreviations. You take an MRI or CT and put it up and start talking, this is the frontal lobe, this is the temporal lobe, and there is a lesion. Patient may not understand. It can be like Greek and Latin for them. So please explain all this in very simplified terms so that the patient can understand what they are suffering. Explain in detail the medicines to be taken and also the dietary advice. Now, many of us do write a prescription. So what has to be taken in the morning, what has to be taken in the afternoon, what has to be taken in the evening. This has got to be explained in detail to the patient. Many of the times, many patients get confused when 2, 3, 4, 5 medicines are written. So when to take, how to take, before food or after food, all those. It takes only around 2 or 3 minutes for you to sit and explain to it. So therefore, this is in fact very, very important. Explain in detail the medicines to be taken and also dietary advice. Many of the patients, they feel this dietary advice should be given by or should be set by the doctors in charge. They feel be very happy when they hear it from the doctor, though it is the problem of the dietitian or the nutritionist, but it is we people who in fact have got to talk about the dietary advice. This becomes very, very significant for even patients with diabetes, hypertension, or any disease rather, cardiac, renal. So explain in detail the medicines to be taken and also the dietary advice. Ascertain that the patient understands the information you have provided. You can in fact ask them to repeat what has been told, especially with regard to the medicines, how they have got to be taken, and what diets they have got to take. You can just ask them to repeat so that you will understand how much they have understood. This will help in the compliance and adherence. Encourage the patient, after all this, encourage the patient to ask questions and clarify all the doubts. This will establish or develop a very good trust and improves the therapeutic doctor-patient relationship. Extremely important. Finally, you must say about the follow-up appointment, either by phone, email, or you can say over the phone. And you should fix up the appointment for, if you say 2 weeks later, see that an appointment is fixed and let them prior bring up and then come on. So all these things have got to be discussed with them. Very, very important. As the patient leaves the room with all their documents, please stand up and wish the patient. Okay, that's extremely important. The patients will be very happy. What are the advantages of such a type of a communication skill with the patients developing? It improves the health function and emotional status of the patient. Compliance or adherence with the medical treatment is ensured or assured. It improves the patient satisfaction. It improves the clinical satisfaction too. Satisfied patients are advantages even for the doctors in terms of greater job satisfaction, less work-related stress, and reduced burnout. Very important. In various forms of communication are there. Talking, 30%, reading, 16%, writing, 9%, listening is 45%. It's very important. So listening forms a major part of the communication. Being listened to is one of the most gratifying feelings. The feeling of being heard, the feeling of being cared is perceived by the patient. This is the most gratifying feeling. Somebody is listening to you. Very, very important. The patient must feel at all times that they are treated with respect and utmost affection. Very, very important. That means you are respecting the dignity and the autonomy of the patient. Dignity is a right to be respected. I have to be respected and I respect you all. And autonomy is a right to make a free, the involuntary decision. You know, they take a decision by themselves. Very, very important. A free voluntary decision, a free voluntary decision has got to be taken without any coercion. And that is what is autonomy is. So the patients must feel at all times that they are treated with respect and utmost affection, and that's very important. As pointed out by Dr.K in his vice presidential address in the American Academy of Orthopedic Surgeons, the patient will never care how much you know until they know how much you care them. Very important. That's in brief, ladies and gentlemen, on this part 5 continuing medical education program, the theme on the significance of doctor-patient communication. This is especially for the junior colleagues of mine in this noble medical profession. Thank you. Thank you very much.